15 research papers here, and there's thousands. There's probably a couple thousand. And so you need to be aware of all that. There is not a one-shot deal. One of the things that we see online is people want to know, what are medications for fibromyalgia? Well, there are none. There are medications to kill the pain by killing your brain, essentially.
Yeah, or shutting your brain off.
Or shutting your brain off. But there's really no medication for fibromyalgia because it's a multifactorial problem. In other words, one of the biggest things I want to get here today is we can get 100 people to come in here with fibromyalgia. No two of them are exactly alike in the mechanisms that are affecting their brain or in the parts of their brain that are affected. It's like this big lottery that you have to hit. First of all, you have to take a history and do an exam to gather all the different pieces, all the different numbers that are involved in winning this lottery or making this diagnosis. Then you have to put those numbers in order because there is a hierarchy of treatment.
Yeah.
And you have to treat the right thing first because one thing is going to affect the other. If you think the body's not complicated, I mean, your liver does 350 things. Your liver might be involved in your fibromyalgia. Oh, and it might not. How do you know? You have to do a thorough exam. You have to take the time to do it. You have to do a thorough history. You have to know what you're doing. And that will then dictate the testing that at this point should be relatively confirmatory. Shouldn't be a big surprise, but give us the details that you need to fill in the rest of the story so that you can put those numbers in order and win the lottery. In other words, meaning stop the downward progress of your fibromyalgia, reverse it, usually substantially, and then understand the tools that you need so that you can continue to manage it on your own without having to see a bunch of doctors and a bunch of people who kind of don't know what to do with you anyway. And after like the third or fourth or fifth time you go into the ND and they don't know it, and you see them kind of glance over and your file's getting that kind of thick, you're done.
Let me go on that point.
Go.
Okay, there's a chapter in Kelly's book of rheumatology on fibromyalgia. And I'm sorry if I'm overly pedantic, but we only do that from the standpoint.
This is great. This is great. If you haven't gotten it, like, he's the research guy, okay? And this is what makes us a good team.
And we know that some of you are across the world in Switzerland watching this, and you may want to know where we get this information. So that's why I give it to you. But anyways, in this textbook, which is the gold standard textbook in rheumatology in the States, here in the U.S., they talk about how many rheumatologists don't even like treating fibromyalgia patients.
No,
they may not even accept them. Yeah, because they're hard to deal with. They have all these complaints. There are many other comorbidities, as it's termed, you know. Suicidal ideation. There can be interstitial cystitis, to migraines, to depression, on and on and on. And on that point that you made about the drugs, here's a really nice article from Arthritis Research Therapies. And they said, many drug treatments for fibromyalgia have undergone limited study and have had negative results. Both the potential for medication therapy to relieve the symptoms and the potential to cause harm should be carefully considered in their administration. So, just as Dr. Rutherford was saying, there's not one medication that cures fibromyalgia, and everybody out there with fibromyalgia probably knows that. Probably know that maybe they got a little help with Cymbalta, or a little help with Cybele.
Our average fibromyalgia patient walks in here is on, what, 5 to 15 medications?
Yeah.
We had one that was on, like, what, 23?
20, it was over 20.
Over 20 medications. That's insane.
And we have a hard time helping someone once they're on that many medications.
That's a little difficult.
Yeah. So do we want to go into the 4 groups of fibromyalgia patients?
All right, so a lot of people want to know, you know, what's fibromyalgia? And again, I just got done saying, it's a stupid term. It doesn't mean anything. It does not tell you how to fix it. It doesn't tell you what's wrong. It puts you in a bad category and so on and so forth. But and listen, we're a good team, and we're a comedy team, right? I'm the guy who's been practicing for a while, and I just basically, I'm not the most academic guy on the planet. I tend to go by what works and what doesn't work. And when you've seen as many patients as we have seen, you get to see consistent patterns. And the studies can say what they can say, but studies are limited. Studies are limited by, I mean, they're making billions of dollars out there doing studies now. So it's an industry. Studies are, you know, sometimes they're influenced by, you know, who's paying for them. But, you know, frequently they're just influenced by the fact, like, how easy is it to study the human being? Let's just say you're studying one particular aspect of the human being, nutrition and fibromyalgia, and the person is being studied are stressed out of their mind.
Right.
So they're stressed.
Good example.
So they're putting their so they're stressed, and their cortisol, and they're checking their B12 levels, and they're stressed out of their mind, and they're putting out these chemicals. Most people are aware of adrenaline when you put it out, but it puts out way more than that. It puts out chemicals that damage your brain. It contributes to your brain fog, your short-term memory loss. It can contribute to damaging your lungs. It can contribute to damaging your immune system. It can contribute to damaging your gut. Oh, which by the way might influence your ability to absorb vitamin B12. But they're going to study you. It's hard. It's just hard. Okay, it's hard to get enough people to get into a study to find. It's just hard. So the studies are great and they're scientific and they're this, but this is why one person tells you to eat salt, one person tells you not to eat salt. You know, one person tells you it's good to drink wine, and one person tells you it's not. And people are confused. Okay, we're not confused because where we work is where the rubber meets the road. Our patients get better, but it's because we've had to combine the studies that Dr. Gates has so accomplished in pulling together for us, along with responses to care and so on and so forth. So we have a fairly strong idea that we're pretty immovable on relative to what fibromyalgia is. And we have seen some things that have shocked me beyond anything I could possibly imagine. I remember my first fibromyalgia patient, and they were telling me about their sexual abuse, and they were telling me about all their symptoms, they were telling me about their drugs, and I just went like, whoa, what am I getting myself into here? And we now know what we've gotten ourselves into, and we have a pretty good idea what's going on. Dr. Gates mentioned that there are 4 different, we have essentially
absolutely
together what we believe are the 4 groups of fibromyalgia. I hate that term, but fibromyalgia patients, we need to communicate. That is based on our observations, and I'm going to let Dr. Gates take over on that because it's mainly a lot of his research and a lot of his observations, and a lot of what we've used to help people to stop this downward spiral, and reverse it and so on and so forth. Used it myself, by the way. I'm in pretty darn good shape, I might add.
Yeah.
But go ahead.
Okay, so the first group of fibromyalgia patients that we don't commonly encounter because we don't give out narcotics here, we don't prescribe medications, are those who are addicted to narcotics. And it's a whole realm of its own that I'm not going to go into to a worldwide audience. But just know certain people become very dependent on these narcotic medications. They may be diagnosed with fibromyalgia, and only because I have a lot of friends and family in the medical field do I hear about their opinions about fibromyalgia patients. And I believe it's those who are addicted to these drugs that give the fibromyalgia patient population some of its stigma. Let's just say it that way. And I hope that doesn't sound prejudiced anyway. It's just, that is a fact of the matter.
No, we have to stick to, we're trying to be objective.
Exactly. The fibro patient needs to know.
These people are looking in because they want to stop searching everywhere. Right. They want to get some real data.
The next group of fibromyalgia patients have typically endured atrocious physical, sexual, or emotional abuse.
Or verbal.
And it's heartbreaking when we hear these case histories time and time and time again, and it is so ridiculously common, and it is well cited in the literature and the textbooks relative to this issue. Now, what you need to know out there is that when you are under severe stress chronically from whatever mechanism, whether it's physical, sexual, emotional, verbal, whatever, those stress hormones make your spinal cord learn pain. Let me say that over again. The stress hormones make your spinal cord learn pain.
We're getting to the part about it's in your head.
Yes. So if we had a patient who's a plasma physicist,
right,
and his son, I think, was 11, and was more advanced in mathematics than anyone at the local university here in Reno. And basically it's because this little kid did nothing but math. So if you do things a lot, you get good at them. That's neuroplasticity. Well, there can be neuroplasticity in the pain pathways, and stress hormones are one of the key drivers of that mechanism.
Meaning your pathways, your brain, your nervous system can learn pain.
And only one more tangent on that subject. All of you out there who have fibro and have been exposed to awful circumstances need to get the book Why Zebras Don't Get Ulcers by Robert Sapolsky from Stanford University.
They do get ulcers.
They do.
But you should get the book.
But the book is awesome.
It's phenomenal.
It's the best book on stress, and we'll probably mention it every week.
Yeah, you'll love it. You'll love it. All of our patients have loved it. They get it.
So the next group of fibromyalgia patients have immune.
Okay, well, can I go back to that for 1 second? Would it be fair to say that the sexual, the physical abuse, the emotional traumas, would it be fair to say that they affect the brain by getting into a certain emotional part of the brain and they kind of stick there?
They do. You can look at it from that standpoint, and in large ways because
in addition to what you just got done saying.
Yeah,
because what I have noticed, and I don't, and this may be, and we're just talking here, okay, this is how we figure everything out. But I kind of make it analogous to when you go to a movie. If you were to go to let's say one of these crazy movies where they're chainsawing people to death and all that type of stuff, if you were to go to that movie and watch it without the music, it would be pretty non-issue. Would you agree? I mean, it'd be silent. You'd be watching somebody go like that. You would hear nothing, right? But if you get that music, does that not